Do you know the difference between Viagra and Cialis? Well, today, that's what we're going to talk about. We have gathered the results of scientific research, experts and respected doctors in the field, as well as related studies, and below, we bring you this valuable insight. Before we get into the actual treatment with these erectile dysfunction medications, it's important for you to understand how an erection happens. The first component of an erection is arousal. You see something, you smell something, you hear something, or you feel something that gets you aroused. That causes your body to release something called nitric oxide. And nitric oxide is like the ignition for erections. So, in order to get an erection, you need arousal and you need nitric oxide. What is the reaction of your body? Your body starts releasing a number of chemical messengers. As these messengers are released, the muscles or the smooth muscles in the penis relax. This allows blood to freely flow in, and at the same time, the veins of the penis get blocked off so that blood flow stays in the penis, causing a firm erection. You may then wonder, what stops the erection? There are three major things. First, that nitric oxide or the stimulus for arousal goes away. Second, that chemical messenger starts to degrade or break down. And lastly, your body has a nervous response to ejaculation. When ejaculation happens, your nervous system revs up and causes those smooth muscles to now contract, forcing the blood out of the penis and into the rest of the body, which then causes your penis to become flaccid. All of these medications for erectile dysfunction work by blocking the breakdown of that chemical messenger, and they do so by blocking an enzyme called phosphodiesterase. You may wonder, why are we talking specifically about Viagra and Cialis? Well, because these are the cheapest options for erectile dysfunction, and because they are equally effective. The generic name of Viagra is sildenafil, and the generic name of Cialis is tadalafil. It's really interesting to know that sildenafil, or Viagra, was originally made as a treatment for high blood pressure. Clinical trials were conducted on patients to see if it would improve their blood pressure. What they found was that it didn't do much for blood pressure, but people started reporting stronger and firmer erections. And that's how Viagra was born. Let's first consider, what is sildenafil or Viagra, and how to take it? Sildenafil, commonly known as Viagra, is the oldest medication available for erectile dysfunction. When you take Viagra, it's important to take it about 30 minutes to an hour before intercourse. Additionally, it should be taken on an empty stomach. Consuming high-fat foods before taking Viagra can reduce the medication's efficacy. Once taken, it remains active in the bloodstream for about 4 hours. Viagra is available in different dosages, ranging from 25 milligrams to 100 milligrams, and it is only offered in what is called on-demand dosing. This means you should only take it prior to intercourse and not as a daily medication. Taking it daily is not recommended. Let's now consider, what is tadalafil or Cialis and how to take it? Tadalafil, commonly known as Cialis, is a more selective phosphodiesterase inhibitor, meaning it more specifically inhibits the enzymes responsible for erections. It was released in 2003. Similar to Viagra, Cialis needs to be taken about 30 minutes to an hour before intercourse, but it can be taken on an empty stomach. One of its key advantages is that it lasts in your bloodstream for up to 36 hours. This makes it a great option if you want to have multiple episodes of intercourse over a weekend. Cialis is also available in a low-dose form that you can take daily. Many people prefer this option because it allows for spontaneity. Taking one pill every day means you can have intercourse whenever you want without planning ahead. The on-demand dosing for Cialis ranges from 5 milligrams to 20 milligrams. While this is less than the dosing for Viagra, it doesn't mean Cialis is less effective. It's simply a different medication. Unlike Viagra, Cialis is also used to treat benign prostatic hyperplasia, BPH, and pulmonary hypertension, giving it a broader range of uses. Lastly, some data suggests that men with complete erectile dysfunction, those who experience no erections at all, may respond better to Cialis than to Viagra or other similar medications. So, which one is better for you? Next, we'll share some data comparing Cialis and Viagra to help you make an informed decision. First, we want to share with you one large meta-analysis. Meta-analyses are studies that review all the published data on a specific topic. They perform a systematic review, meaning they analyze specific data from multiple studies, combine it, and produce a much stronger and more reliable study. This particular meta-analysis compared Cialis and Viagra head-to-head. To do so, they used a specific validated questionnaire to measure erectile dysfunction outcomes. The results showed that the efficacy of both medications was about the same. However, the study also evaluated additional factors, such as how the partner perceived the quality of erections, the patient's satisfaction with the treatment, and adherence, how regularly patients used the medication. Interestingly, people who took Cialis reported better self-esteem in their relationships and greater satisfaction with their treatment. In 9 studies that specifically looked at preference, participants were asked, "What do you prefer?" In these studies, both the men and their partners showed a preference for Cialis over Viagra. The study also found that persistence, continuing to use the medication, and side effects were similar in both groups. The only notable difference in side effects was that Viagra users were more likely to experience vision changes, while Cialis users were more likely to report muscle aches. And that brings us to our next question. What are the side effects? You must be aware that there are some side effects common to all of these medications. These include headaches, flushing, nasal congestion, heartburn, and occasionally vision changes. The side effects unique to Viagra include a condition called blue-green discoloration, or changes in color vision. If this happens, you should stop taking Viagra immediately and consult your doctor. Another side effect sometimes seen with Viagra, but not with Cialis, is nosebleeds, although this occurs in a small percentage of people. There is one critical warning. If you are taking nitrate medications, you absolutely must not take any erectile dysfunction medications. Nitrate medications, such as nitroglycerin, are often prescribed for chest pain or angina. Nitroglycerin is typically taken as a pill placed under the tongue to relieve chest pain. If you take a nitrate medication and an erectile dysfunction medication at the same time, your blood pressure can drop dangerously low, putting you at risk of death. Additionally, certain medications can cause drug-to-drug interactions. For example, if you have kidney or liver problems, your doctor may need to adjust the dosage of your erectile dysfunction medication. In these cases, it is essential to consult your physician. There are also a couple of very rare but serious side effects associated with these medications. One of them is called priapism, which is an erection lasting longer than 4 hours. Priapism can be dangerous because prolonged erections can damage the tissues in the penis, potentially causing irreversible harm. This condition is most often seen when someone overdoses or takes too much of the medication. Another rare but potentially serious side effect is hearing loss, which has been reported in some cases. In terms of efficacy, both Viagra and Cialis have a success rate of about 60 to 80%, meaning they are equally effective for most people. So, what would we recommend? Well, if you have urinary symptoms, we recommend taking 1 dose of Cialis every single day. If you are looking for an on-demand medication, you can try either Viagra or Cialis. If one doesn't work, you can switch to the other. When comparing them in terms of psychological outcomes, tadalafil, Cialis, appears to have a better effect. The side effects are also fewer with Cialis, and you don't have to worry about food intake affecting its efficacy. Therefore, we can conclude that Cialis may be a better choice for erectile dysfunction treatment. There are also several other treatment options for erectile dysfunction besides medications. These include suppositories that go inside the urethra, intracavernosal injections, vacuum erection devices, and penile implants. If you're interested in learning more about these options, comment below, and we'll create videos about them as well. However, it's not always the best idea to rely on medications that come with side effects and potential future complications. There are many other ways to improve your erection and live a healthy life. We've already made a video on that topic. Check the link in the description to watch our dedicated video on erectile dysfunction. Thank you for watching, and if you enjoyed, please subscribe to our channel.